Thank you for staying with us. Despite hues and cries about state of our health sector, exodus of medical doctors abroad continues unabated. About 200 Nigerian trained doctors have been licensed by the United Kingdom to practice in the country in just 1 month, according to information on the website of the General Medical Council. They were licensed between 31st of August and 30th of September. 1,307 doctors were licensed between the 1st of January and the 30th of September 2022, giving a total of 10,296 Nigerian doctors currently practicing in the United Kingdom. Jide? About 200 Nigerian trained doctors have been licensed in the United Kingdom, and we begin to see
1 month.
Just in 1 month. And this kind of when you see this, and it doesn't look as if this government is perturbed about this kind of reports, because there was a time people were coming to headhunt our doctors, and they had locations, and we know they were living continuously. It didn't just start today. And over time.
The time when the minister, Chris Ngige, said we have enough doctors.
Yes. We waited. How can 200 doctors?
In 1 month.
In 1 month.
Let's even look at how it's been. You see, economic migration is not a strange phenomenon, but economic migration will be on the rise when the economy of your country is not doing well and the people's well-being gets challenged. We are talking about a time when Ghanaians were here teaching. Some of them were even shoe shiners, and they left their country, in the very early 80s. There was a time when we had Indian teachers here. I had an Indian teacher teaching me mathematics, and so many other people, schools were using them at that time. Today, do you see Indian doctors in our country? How many Ghanaians are here doing the sort of work that they were doing those days, for which we were even ridiculing them? The whole idea of Ghana must go, when we said they must go, that they were illegal aliens during the military rule of President of Buhari. So in 2015, only 233 Nigerian doctors moved to the UK. By 2016, it moved to 279. 2017, 475. 2018, 852. 2019, 1,347. In 1 year, something that started with just 233 in a year. Then 2020, even during COVID, when the General Medical Council said, no, we are not even taking doctors, 833 Nigerian doctors during COVID still went to the UK. So in 2021, 932 Nigerian doctors went to the UK. And it's not only UK that they go to. They go to Australia. They go to the US, they go to Dubai, they go to Canada. So if people that we have, to train doctors is a very expensive business. People that we have trained in our medical colleges, they don't want to work here. The environment is harsh for them. Opportunities for training, because the training slots are not many, so the opportunities for training are slim. So a lot of them just feel that, yes, it's better we go. And the UK appears to be the best place for them because the environment is conducive for foreign doctors to come and apply their trade. Then, talking about economic migration, what is the underlying motive? You want to earn enough money to be able to take good care of your family members, to kind of create a good future for your children. That's why we work. In the UK, the base salary, when you are coming in, the base salary for the average a Nigerian doctor, fresh, coming into their country, is a salary of £4,000 a month. That is, when converted to our currency, is 3.3 million naira a month. Nobody, no doctor will earn that kind of money here.
3.3 million.
Okay. Now, if you are
federal government institution.
Now, if you are a consultant, your annual salary is £119,000, 183. By the time you convert that to our currency, it is 98 million a year. So we don't need to go scoring everywhere, trying to find out why people would rather go over there. When we are talking about Canada, I'm sure that we are going to still look at this topic again because this is raging, is even getting worse. You know, when we are talking about Canada, it's similar. In Germany too, it's similar. They have an aging workforce in Germany. And Germany, the economy, you know, has begun to do very well. They need to freshen up the workforce. And where do they find people? In some of the poorest countries of the world. Africa and some parts of Asia. In the UK, Nigerian doctors working in the UK, they are the third highest behind India and Pakistan. So you can imagine, they are so well sought after because they know that they've got it. People who ridicule Nigeria, who talk down on even the quality of our federal universities. My own younger brother, our last born, is a medical doctor. And a lot of his friends have gone abroad. When they sit, they set exams for them, they sit, they pass one time.
That's what I would do. That's Paul.
Yes.
Because the conversion exam, there's always a conversion exam.
Yes.
And our doctors, our medical practitioners, at any given time, they pass this exam.
Yes.
They pay a huge amount of money. They pass this exam.
It means that the schools that train them are still good.
Yes.
And that's the reason we must keep the standard high.
Yes.
Yes, very well. It is not that they don't have good training in this country. Now, the statistics BKO reeled out, I have similar statistics. But let me just add that currently, we have over 10,000 Nigerian trained doctors in the UK. And those who were trained in Nigeria. This excludes those who were trained in the UK, but over 10, that's 10,296 in the UK currently. For me, it's a very sad development. But it's also an eloquent and loud testimony to the fact that things are progressively getting worse in this country. These people who make the exodus to a place like UK are actually saying that they don't have a bright future in the country, economically, professionally also. Many of Nigerians do very well. Nigerians are very intelligent. Not just only medicine. Nigerians that go abroad and go for other disciplines to do very well. It's just that we don't have an enabling environment. For me, what it says is we're having failure of leadership. This brain drain happening in the medical sector, it calls for concern. So we just need purposeful leadership to arrest this downward trend. We are in serious doldrums here.
No, not a leadership that even considers this brain drain as no big deal. Not a leadership that thinks that we have more than enough. How do you determine that we have more than enough? I mean, what sort of talk is that? The tertiary medical institutions here are saturated. Go to the general hospitals.
Yeah.
The rural areas, the health centers there, they are supposed to be manned.
Yep.
In some cases, it's just an ancillary nurse that's taking care of the. That's not the. It was not designed that way.
Yes.
It was not designed that way.
When Professor Luki Ransomkoti, when he was classifying this thing, we have primary, secondary, and tertiary.
Yes.
And this tertiary, they're meant to and do advanced cases. Not that I have fever. Not
There's
that I
supposed to
have
even be
typhoid,
research centers. There's supposed to be research centers.
So I was having serious problem with my eyes, and I went to one of the general hospitals. Not even the one at Ikeja, not Lasut, the one at Ilepo. I went there, and then of course you had this long queue. You had to go very, very early, and then you will not even see. I didn't see the doctor that day. I saw someone else, and they said, come back like 2 months, 3 months. So I said to the person, I said, what if I go blind before that time? Do you know how serious? Eventually, I had to switch. I switched from the general hospital to a private hospital.
And you might not
Of course, I'm consulting with a very big one now, and what I paid, so much.
Let me tell you, in the Northeast, there are some communities where we have failed in the health sector to the point that people travel to Cameroon to go and take care of their health challenges. Cameroon.
We have a caller. Ade is calling us from London. Thank you for joining us, Ade.
My greeting to including the prince. Everything
Go ahead, Ade.
Babajide said is the truth. Everything Babajide said is the truth. I went to say hello, greet my friend, one of my friends in the hospital. Very massive hospital in North London. And when I got there, there are 4 people in the ward. And one of the people in the ward, they were waiting for a surgeon. And they say they have only one who specializes in that area. So when the surgeon came, lo and behold, a Yoruba man, doctor, I was shocked. I now speak to him, I say, you are the only one. I say, he's the only one running the place for that speciality. But he will soon leave the hospital because he's got another offer again in UK. More money. So you can imagine how important Nigerian doctors are here. And we are losing them in Nigeria. So everything Babajide said is the truth. A GP can earn £100,000 a year. That is a doctor you come and see.
Like a country in big, this kind of big crisis is not limited to the health sector alone.
No.
Everybody now is to go and do, between you get 8 to 10 million naira, is to go and do masters in the UK, and they don't have plan of coming back after.
Some go to school. They want to go to school in Canada.
Yes, they go with their families
without any plan to come back.
They go with their
as difficult as things are in our country, the outbound flights are fully booked. When you go to the departure lounge of the international
most of the
wing,
flights are over 1 million naira.
You will see
2 million naira
the
to
departure
UK,
lounge
2 million naira to America,
bursting at the seams with people, heaving with people. The departure lounge.
They want to leave this country.
People want to leave. Somebody said it's normal. Statistics will show to us that it's not normal. Because if only 233 doctors immigrated from Nigeria in 2015, and now
7 years after,
we're 2021,
we're having this kind of emergency
932. So how can you say it's normal? Some of us want to justify everything. And you can't justify everything.
These people leaving the country, majority of them is not as if they are happy.
No,
but they are forced out. Nigeria, they are not happy.
They are not happy.
Reminds me of a friend.
They have to survive.
Reminds me of a friend in the UK. He has been there for a long time. He said, look, if Nigeria was good, I would not be here. He said, do you know what I endure here? The racism, the insult and everything. He said, I still have to go through that because in Nigeria, no show.
So when I was telling someone that I was wondering why somebody was earning in excess of 1 million a month, decided I was relocating to Canada. That was like 3 years ago. You know, when the currency wasn't this bad. He said, Jide, when you face a real health challenge, God forbid, you know that earning 1,500 naira a month is not money.
1.5 billion a month.
Yes, he said it's not money. When a real health challenge confronts you, and I started, you know, if it's dialysis, you know how much it is.
God forbid.
Just one session, you know. Whereas in some of these countries, they can even treat you for free for some of these ailments. For
like
which
diabetes.
People are paying a fortune. So we just hope that things will change. And kudos to the universities here that are producing these doctors. The fact that they are accepted over there means that the quality of training is still good enough. And we owe it a duty to ensure that that quality does not decline.